Hello everyone, welcome back on this channel. And as you can see on the screen in this video, I will be providing you with the IMP topics marking from BD Chaurasia 10th edition for your internal exams as well as external exams for students of first year of BPT, specifically for MUHS University. So the markings which I will be providing are the questions which comes mainly from the university, and some are from the most asked questions from the internal exam. So you can watch this video and mark down it in your own textbook so that whenever you sit for revision before your exams, be it internal or MUHS University, you should first go through with these topics and then continue with the further. So let us begin with our part 1 of BDC marking series, which is of upper limb, which includes upper limb as well as thorax. So just pause this video for 2 minutes and get your upper limb textbook along with you. See, if you don't have 10th edition, whichever edition you have, but the headings are same, you can mark it along with this video. See, just watching this video randomly will not help you. I want you to mark it in your textbook so that you remember it forever. Pause this video right now and go and get your textbook. So I hope that you are ready with your textbooks, and now let us start marking the topic. So yes, in the bones section, majorly the students of first years confuse and they think that each and every bone is to be done for viva, which is hard parts. So no, that is not any specific rule. You should be very well prepared with 2 to 3 bones of each limb, such as upper limb 2 3 bones, lower limb 2 3 bones. So now I'll be giving you markings. So firstly, clavicle is a very easy bone, you can prepare it. And you should be very well aware about the features of the bone. In the starting or in the beginning, the examiner asks you about the features, and if you are very well confident and you mention the features correctly, the examiner nearly forgets about asking you the attachments. So always make sure that you are clear with the features, be it the borders or the surfaces, and then you move to the attachments, as attachments require the basics of it. So I hope that you are clear with the attachment feature thing. And then is the clinical anatomy. So while you are learning a bone, never forget its clinical anatomy. In fact, while you are learning any topic from anatomy, clinical anatomy is the major part. Okay, so now clavicle is done. Let's move towards scapula. It is also the most easiest bone of upper limb, I would say, along with clavicle. Again, same side determination is also one thing which you should never forget. Side determination, features, and the attachments of scapula is in fact very easy. And for clinical anatomy, you should be very well aware about the winging of scapula. Okay, so then comes our humerus. So humerus is the second third important bone of upper limb. So again, side determination, features, then muscle attachments. I would prefer that you guys look onto the flowcharts given in BD Chaurasia 10th edition so that you can revise it easily and very quickly. So these flowcharts are really very well, and I thank the author to make this book for our students. So yes, go refer the flowcharts first. Then let's move on towards the radius. So radius is not that important, but if you want, you can do it. Don't forget to do the clinical anatomy of humerus. Then and also please remember the relation of axillary, radial, and ulnar nerves to the back of this, as when you are giving injection, so you should be very well aware about where the injection should be. So in generally physiotherapy, students don't give injection, but for the clinical, you when the pain comes with the axillary nerve injury, you should be knowing the background of what might be the cause of the injury. So for that, you should be knowing regarding the locations of the passage of arteries or nerves related with the clinics. So now, yes, now is the carpal bones. So you should learn the names of carpal bones. Learn it with the headings, proper headings. So you should learn the proximal row in a sequence and then the distal. Please don't shuffle the names when the viva person or when the examiner asks you regarding the carpal bones. He may ask you in hard parts also, as well as in the x-ray also. Okay, so x-ray carpal bones is asked. So for that, if any examiner shows you an x-ray and he'll ask you which is this bone, which is this, so you should be very well aware regarding their shapes and their names. Got it? Now comes the mammary gland or breast. again, this is the part you should learn. So location, shape, extent, deep relations also you have to learn. Again I'll suggest that you should learn flowchart and one diagram. See, this is the diagram, learn it. Then pectoral muscle, not that important, but if you want you can learn regarding the serratus anterior, as it is one of the majorly asked PYQ. Also pectoralis major. Then is the clavipectoral fascia. Which structures pierces the clavipectoral fascia? Generally asked in 3 marker question. Again, enumerate this question, it is asked, and this diagram. Next is axilla. So axilla, again, the either 7 marker is asked or either 3 marks is asked regarding the axillary artery and its branches. So if 7 marker is asked, you have to write about the boundaries, contents, everything. And if 3 marker is asked, it will majorly ask you regarding the branches. So yes, that was it. Then comes our brachial plexus, again the most majorly favorite topic of our anatomy teachers. Brachial plexus, again diagram is most important. If you want to learn how to draw brachial plexus in a very easy way, I have uploaded the video on my channel. Go and watch it. Easily you can understand how to draw brachial plexus and you will memorize it along with the video. So again, for the brachial plexus, memorize root, trunks, division and chords, lateral, medial, posterior, everything, and clinical anatomy, Erb's paralysis and clump case paralysis, never ever forget. Then comes the scapular region. Deltoid is an important muscle, learn its origin, insertion, everything, and also you can learn the diagram of this muscle. So if they ask you about a specific muscle in 7 marker, then you should know how to draw the diagram also. See, this diagram is important where you can show different types of fibers in deltoid. Yes, this is deltoid. And yes, then the rotator cuff. Rotator cuff is also the most important question asked. See, I mentioned regarding the axillary nerve in humerus. So this is the clinical anatomy which relates it with the deltoid, so refer this also. Then again, musculotendinous cuff or rotator cuff diagram along with its muscles, you should learn this. And then yes, intramuscular spaces, learn the flowchart, this is enough, and if you want you can draw the diagram. Then comes axillary artery. Yes, axillary artery is also important, learn its relations and branches, and clinical anatomy as well. Muscles of arm, every muscle you should know its origin, insertion, nerve supply and action. Then comes the cubital fossa. Again, diagram is important, features, everything is important regarding the cubital fossa. First read the flow chart and then go through the theory. Diagram is very well important. Then comes the posterior compartment, and yes, triceps muscle theory, if you want you can read. Clinical anatomy, I would suggest to go through every chapter. Radial nerve, musculospiral nerve. So yes, radial nerve is also important, learn its origin, course, termination and relations, or as well as clinical anatomy. Diagram is also important. Then comes ulnar nerve, again everything same as the radial nerve. Then comes palmar aspect. In palmar aspect, you should learn flexor retinaculum, again structure passing through deep flexor retinaculum, this is majorly asked. Attachments, relations, this diagram is important, this diagram is important. Then is intrinsic muscles of hands, at least you should know their names and classify it as muscles of thenar eminence and muscles of hypothenar eminence, you should know at least the names, and if you want you can learn their origin, insertions also. Then is the muscles of hands, again this flowchart. Nerves of hand, ulnar nerve is also important, again relations, branches, course in the diagram, and clinical anatomy as well. Carpal tunnel syndrome is also mainly astippers, and yes, you should be very well know about the ape-like thumb deformity and the changes seen in the palms with various injuries of various nerves. So yes, this you should be. Then is the anatomical snuff box. Generally boundaries is asked, if you want you can draw diagram also, but if it is available for 7 marks, then only invest your time for drawing the diagram, otherwise no, don't invest your time. For joints of upper limb, shoulder joint is the most asked PYQ. Again, type, articular surface, factors maintaining stability, ligaments, bursas, everything. See, shoulder joint diagram is important, which half of the diagram you will learn in rotator cuff and rest of the muscle in shoulder joint. So yes, again for referring joints, go through the flowcharts first, then you will easily understand the joints. See, for joints you should always draw, if they are asking you about ligaments, then you should draw the diagram also, and relations diagram also along with the theory part. movements of the shoulder joint, then relations, blood supply, nerve supply, everything. And if they are asking you movements, then you should correlate movement along with which muscle is acting, and you should classify the muscle as main muscle and accessory muscle. And then with the joint, clinical anatomy. So for shoulder joint, you can write dislocation of shoulder joint, frozen shoulder, and shoulder tip. Then is the elbow joint, again same type, articular surface, ligaments. Draw the diagram. Relations, bursa, not that much of blood supply, nerve supply, and movement. Mainly carrying angle is asked for 7 markers, so carrying angle is most important topic in elbow joint. Before going through other relations and everything, go through the carrying angle first. And yes, for relations, again diagram is important. And then is clinical anatomy. So for elbow joint, dislocation of elbow, tennis elbow, student's elbow, golfer's elbow, and cubitus valgus and varus. So this is important. Then for radioulnar joint, don't learn that much, but remember that radioulnar joint is a pivot. Then comes the supination and pronation movement. So in this radioulnar joint, this question is asked in 7 markers. So for supination and pronation, you should draw the diagram. This diagram is important, and theory along muscles responsible is also important. And yes, clinical anatomy of supination, pronation. Wrist joint, if you want, you can learn, but that is a lengthy topic. Then comes the joints of hands. So in joints of hands, learn first the joint of thumb. So in joint of thumb, type, articular surface, and yes, this much only, type and articular surface, bus, nothing else. And in viva they ask you which type of joint is first CMC or first carpometacarpal, and generally we forget, so remember that it is a saddle variety of joint. Then let us move towards the thorax. So this topic is the diaphragm. So for diaphragm, generally openings of diaphragm is asked, openings, shape, and structures passing. This table you should learn. Then now is intervertebral joints. See, please refer to the page numbers and mark it in your textbooks. I might not tell you the chapter name, but you can mark it in your textbook and learn accordingly. So intervertebral joint asked in paper, and intervertebral disc also. Let us come towards walls of thorax, typical intercostal spaces and their content. Intercostal muscles also you have to learn their origin, insertion. If you can learn it from this diagram. Then is origin, insertion of intercostal muscle. Yes, if you want, you can learn the nerve. Typical intercostal nerve, yes, the course, relation, branch. And then comes respiratory movements. Yes, this flowchart is enough for you to understand, and after reading the flowchart, go through the theory. Then comes thoracic cavity and pleurae. So pleurae was a unexpected question which was asked in 2025 winter batch question for CBLP. So yes, don't forget to refer pleurae. So yes, comparison of visceral and parietal. Learn the difference, even if you don't remember everything regarding the pleurae, but you remember the basic comparison and you write it in a 7 marker answer with sentence based. Then also the examiner gives you 4 to 5, and don't forget to draw this diagram. Pulmonary pleura, parietal pleura, diagram important. Then comes lungs. So lungs, right lung is mainly asked, but if you want, you can refer or learn left lung also. But learn majorly the structures related to the mediastinal surface of right and left lung. Learn this table, roots of right and left lung, and this difference between right and left lung. It is asked in theory as well as in viva also. So when you are giving the viva of soft parts, you will be asked regarding how to differentiate between right lung and left lung, and then you have to show it practically. So this table will help you remember there also after your theory exams. Now comes bronchopulmonary segments of the lung. Again, learn this table and draw the diagram as well. Not included the diagram, but you can draw the diagram in which they have shown you part wise and they have colored each and every part. If really make the anatomy paper colorful, not that colorful, but yes, mildly colorful, which is interesting to read for the examiner also, then examiner easily passes on to the marks. They don't focus on the theory, they just see your diagram and it is everything is labeled correctly, and the diagram is also understandable, not that creative, but yes, good, then they will give you marks easily. So yes, then comes the heart topic. So this is heart. So for the heart, mainly right atrium. So external features of right atrium, and this diagram is important. Refer this flowchart first and then go through the theory. It is also asked in viva. Then comes the left coronary artery, again theory. Area of distribution is mainly important. Yes, so that was it for upper limb and thorax. So refer these topics first and then go with the other topics. And don't forget to refer your college internal examination papers for terms as well as terminals as well as prelims. So yes, this was it for this video, and in the next video we'll go with the volume 2 of BT 10th edition. So I hope that you have marked with me in your BDC textbook, and again with the second video also we'll do the same. Yes, thank you. Don't forget to like, share and subscribe for more such videos.